Had a good afternoon and welcome to a session on fibroids and infertility. We're glad to have Dr. Garima Sharma among us today to help us understand this topic. Uterine fibroids are common and can affect fertility in many ways. One of the ways is it may cause infertility by obstructing the fallopian tubes and impairing gamete transportation. So the doctor will help us better understand this topic and give us a lot more information on it. So doctor, you have the stage.
Thank you, and thank you for that kind words of introduction. And I think it's been a long gap of about 2 months, after which I'm getting to connect with you all. And therefore, I thought that let's begin with something which is as basic as fibroids and a topic which is concerning to every other woman. So we get so many inquiries, we get so many calls the moment people are diagnosed with fibroids, and they literally freak out. What is happening? So, doctor, have I got cancer? What's coming up next? What do I expect? Do I have to undergo surgery? So that these all questions are going to be a background for what I'm going to talk about fibroids, and we will narrow it down to how your fertility is involved because of the or impacted because of the fibroids. So my junior doctor, she did a very beautiful task, and she actually took a Google survey and looked for the commonly asked questions or concerns about fibroids and its impact on the fertility when it comes to the layman. And she's given me a huge list of these questions, and which I'm going to take it one on one. So at the end, I'll be all open to the discussion forum where you can come across with all your questions. So going with as simple as what are fibroids? Now you have to understand fibroids are the most common non-cancerous tumors of. So the word non-cancerous is the crux. Fibroids are not cancerous. Yes, we call them as tumors, but tumors can be cancerous as well as non-cancerous, and these fall into the category of the non-cancerous zone. So, when it comes to fibroid, there is always a curiosity to know what is the reason behind having these fibroids. And unfortunately, till date, we have not been able to pinpoint onto, okay, this is the culprit, and this is the treatment for that. So, there are genetic linkages, especially from your maternal side, which can increase your chance of having a fibroid. Then there is an interplay of hormones. So, some of you who are attending the lecture today and have gone through a treatment of fibroids, you must have noticed your doctors prescribing medications which have either progesterone or a combination of estrogen and progesterone, because these are the two most important hormones which play an important role in the setting of a fibroid, and obviously they eventually become the treatment line also. So, having said that, you also want to know whether there is any particular set of women who are at risk of having fibroids, and how common is this fibroids. So, if we look into a global literature, you can see about 50 to 60% of the women having fibroids in their entire reproductive lifespan. So, the lifespan can go as early as 20 to as late as your menopausal age of about 50. Now, when I said that 50 to 60% of the women have fibroid, the immediate thing is panic, right? But then the good news is that it's only about 20 to 30% of these women with fibroids who will have the symptoms and might need the treatment for the same. When it comes to fertility, it is also more important for you to understand that if I'm talking about an infertile woman, there could be about 5 to 10% women who might also have a fibroid. But if I have to narrow it down to a concept that how many of these women have infertility because of fibroids, it is just 2 to 3%. So starting from that 50 to 60% to 20 to 30, then 5%, and then 2 to 3%. So I think that in itself gives you a sigh of relief that fibroid necessarily does not mean infertility, and fibroids necessarily does not mean that every infertile woman will need a treatment for the same. Then there are certain conditions which definitely, yes, increase your chance of having fibroids. And as I initially also mentioned, it is about the genetics, and especially maternal. So, your mother, Masi, Nani, your sisters, anyone with the fibroids increases your chances also of fibroids. So, it's a good idea that probably after about 25 or 30, a yearly ultrasound as a routine checkup can be done just to figure out if you have fibroids, and if yes, then are they increasing in size over a period of time. Then women, or precisely girls who get their periods very early in the lifestyle, or women who start delaying their pregnancy to possibly at 30 or 35, these are also the women who are at risk of developing fibroids. Then, with these fibroids, how do you really diagnose? I mean, like, if I am curious whether I have a fibroid or not. So, as I said, post 30, it's a good idea that, and especially if you fall into one of these high risk zones, that you can take an sonography, with routine sonography for the pelvis to diagnose a fibroid. Now, once you have been diagnosed with fibroid, or you have symptoms arising because of the fibroid, then there is an advanced modality called as a 3D sonography, a very beautiful modality. It's like a routine ultrasound, but it gives you a lot of details as to how many fibroids are there, what's the size of these fibroids, are they nearing your uterine cavity, is there a possibility of a damage or a danger to your pregnancy results and the outcomes, and eventually you can plan out the treatment also. Now, there is another condition which is equally confusing, looks like fibroid, is adenomyosis, specifically seen, post 35 and 40. And if you want to be really sure before you plan a treatment, whether it is a fibroid or it is an adenomyosis, your doctor might even advise an MRI for the same. Now, if you have been diagnosed with fibroid on just a routine scan, obviously you want to know, do you need a treatment or you don't need a treatment? So generally, fibroids related treatment comes on for those women who have symptoms of the fibroid. Now, the most common symptom is generally periods related. So you could even either have heavy bleeding, or you could have prolonged bleeding. You're bleeding for 7, 10 days, you are passing clots, you are soaking almost about 3 to 4 pads per day, or you can have very bad pain during your periods, or there can be a combination of all these three symptoms. So, menstrual difficulties or these issues are the most important and the most common symptoms. Then, some subset of women, depending on the location of the fibroid, they might also experience pain or difficulty while having an intercourse. So, a young couple who comes to you gives you a history of very painful periods and then very painful intercourse, you would obviously suspect or think on the lines of fibroid. Then a few subset can have urinary issues. So urinary issues can be you have a difficulty in passing urine, or you can't hold urine, which is called as incontinence. Or there is a pressure symptom. So you constantly feel as if something is sitting on your lower tummy. So you are getting those chronic lower back pains and lower tummy pains, which have been there since about 6 months to a year. You take a painkiller, you get the relief. The moment the painkiller is gone, you again come across the symptoms. And these symptoms specifically increase during periods. So all these also point towards having a fibroid. Similarly, other set of females can have issues while passing motion. So you can have constipation if it's a fibroid which is posteriorly located. Infertility in 2 to 3% of the women, yes. More than the infertility, it is women with secondary infertility. That is, those with repeated miscarriages, and then you do a sonography and you see that either there are multiple fibroids, or you see the fibroids are sitting directly into the uterine cavity where the baby is growing. So these are the symptoms which need medical attention, and depending on the cause, the symptoms, the severity, and what is our outlook. Are we looking out for a pregnancy? Are we just concerned about bothersome symptoms? Or our life is largely being managed by just the painkillers. So all those things are going to eventually dictate or define your treatment line. Now, when we come specifically, so now from causes, fibroids, their symptoms, their diagnosis, we narrow it down to How does fibroid really impact your fertility? Now, before I go ahead with this aspect, there are three things that you should be very clear of. All women with fibroids do not have infertility. Okay. Now, women with fibroids and infertility, it is only about 2 to 3% of the women where the infertility is because of fibroids. Third, all women with infertility and a finding of a fibroid do not require treatment. And last of all, your medical treatment, so that is usage of medications to treat fibroid related infertility, does not give you a promising results. So fibroid related infertility treatment is mainly centered around surgery. Okay. Now with these 4 points, we go on to how does fibroid really impact your infertility and who needs the treatment and what can we really do when we talk about the treatment. So first is the mechanical aspect. You know, the fibroids are just sitting, and I think someone just introduced the topic while giving the introduction of the topic. They said that fibroids can sometimes alter your the architect. So you know they can alter the relation between the ovaries and the fallopian tubes. They can mechanically disrupt the fusion of the entry of the sperm and the eggs, they're meeting together. The third is if the fibroids are sitting directly into the cavity where the baby is going to come, they might impact your implantation, which is sticking of the baby into the womb. Or even if the pregnancy is there, it might just keep on, distorting the cavity, keep on irritating the cavity, and can predispose to miscarriage. Then there are certain fibroids which are sitting within the body of the uterus. So on your sonography, you can sometimes see a term called as intramural fibroids. Now, if there are huge or multiple intramural fibroids, they can also constantly irritate the uterus and put a uterus into a contractile stage, as a result of which either the implantation does not happen, or you get miscarriage, or you get bleeding issues, right? So these are and then they also sometimes affect the uterine receptivity, that is the ability or the receptivity of the uterus to take the embryo. So this is important from an IVF point of view. When I'm transferring an embryo in a womb which has large multiple intramural fibroids, and I see back to back negative pregnancy results despite transferring very good embryos, then uh, this could also be a reason that your uterine contractility, your uterine receptivity is getting impacted, and therefore you are getting consistent negative results. So, with this, women who have submucous fibroids, so submucous means which is sitting within the cavity. Of course, you don't want anything in the room where the baby is going to grow. These are the women who 100% need treatment. Second is women who have undergone repeated miscarriages, and on sonography you notice either a submucous fibroid or a very large intramural fibroid or multiple intramural fibroids. Yes, they will need the treatment. The third subset is you have a female has undergone multiple IVF cycles, good embryos transferred on a good uterus lining, and again you see either a submucous fibroid or a large intramural fibroid or multiple fibroids. Again, she would be a candidate who would need treatment. And the last of all, women who has symptoms. So symptoms, what I talked about, periods related, intercourse related, pressure symptoms, urinary symptoms, or constipation, along with infertility, you will again need the treatment for the fibroids. Now, as I said, that when we are planning out a treatment, a 3D sonography gives me a clue and onto planning my modality. That is surgical, which is the route, whether this person will benefit from one single stage of surgery, or she might even require 2 stages of surgery. So 2 stages means you have an interval, so you reduce the uterine mass or the fibroids in one surgery and wait for another 6 to 8 weeks and then do the surgery. So here your 3D sonographies are going to define and give you a clear cut plan. Now, medical management or medications really do not play much role when it comes to fertility and fibroids. And in terms of the surgical route, So if it's a tiny submucous fibroid, I can remove it through hysteroscopy. If it's a large submucous fibroid or intramural fibroids, you will need a combination of laparoscopy and hysteroscopy. But it is important to understand that we, as fertility experts, we deal with a lot of cases where it's not only fibroid, where you have multiple other factors, so where the time constraints also come into picture. So we have women who will come down to us at about 35 or 40. They already have a low egg reserve. We see huge fibroids in. And if I've done a fibroid surgery, which is probably a larger surgery, through a big fibroid I have removed, you need at least good 2 months to 3 months for your uterus to recover and allow me to transfer embryo. So in these women, we do something called like a sandwich therapy, wherein giving due respect to her biological aging, we go ahead with the IVF, we collect the eggs, we create embryos and store. So once I have stored the embryos, at least I am mentally relaxed that I don't have to bother about her declining AMH. Then you plan for a surgery, correct the uterus, give uterus a good adequate time for healing, and then about 3 months later, you plan an embryo transfer. So, from a fertility point of view, this is quite a common scenario that we face. And yes, there are possible solutions which can give due respect to each and every complaint that you come for. Now, this is what we talked about fertility. However, there are some women who will conceive naturally or with treatment, but they will still have fibroids. So the concern is, will fibroids also affect your pregnancy outcomes? Now, this again depends on all those parameters that we talked about. Where is the location? What is the number? What is the size? And what has been the previous obstetric history? So, depending on those multiple factors, your submucous fibroids or large intramural fibroids can have miscarriage rates or bleeding during the first trimester. Then there could be issues with placentation, so you could have bleeding issues in the different trimesters. The third, sometimes some women have also heard terms of red degeneration. So, this is typically in the fifth month of pregnancy because the blood supply to the uterus is more. Obviously, the fibroids are arising from the same part. So, the fibroids also increase sometimes in size and can give a lot of pain. But the good part is that you really do not need surgery. Bed rest, hydration, and simple analgesics are good enough to manage this kind of a situation. Then large fibroids can also have malpresentation. So you can have a breach, you can have a transverse lie, and which increases your probability of a C-section. Preterm labor can also be seen, and increased bleeding during a postpartum period can also be seen. Now, to end this, I talked about some good factors, but I also used terms which could have given scare to some of the people listening to my talk. So, in a nutshell, what I want to say is that fibroids are the most common non cancerous tumors in the female reproductive tract. Having fibroids really does not mean that you are going to have symptoms and you need a surgery for that. So it is always about an individualized approach. So the moment you have fibroids or you have symptoms, rather than going on to a Google information or creating a panic and discussing it in a non-medical community, it is better you seek the help of a medical practitioner in understanding what is your problem. Do you really need a treatment? If yes, will medications help you? If no, and surgery is the modality, what is the route of the surgery? What am I expecting in a surgery? And you can also allay all your fears talking to your medical practitioners. So, my dear friends, fibroids can really sound scary, but it is not that scary. I think you just need a consultation with your expert and you have all your answers in front. With this, I am open to any questions that are there. And in case if there are any questions later on, also, you can always connect with us on our Apollo Fertility website. So I think with this I have answered a lot of questions, and but I'll be very happy to answer to any of those which have been pending. We are easily accessible on our official website, and looking forward to another interactive session with you all. Thank you. Have a great week ahead.